So good night, everyone. My name is Vanessa Ramuta, and I will be discussing the limbic system and memory circuits. This is just an outline of what we will be discussing, just the anatomy and functions of the limbic system, as well as the clinical significance. So the word limbic refers to or means a border or margin, and this refers to a group of deep brain structures which lie between the cerebral cortex and the hypothalamus. It has intricate neuronal connections with structures beyond this zone, and it plays a crucial role in olfaction, emotions, memory, drive, and behavioral processes. It was first identified by a French anatomist named Paul Broca in 1878, and the term the limbic lobe was coined by the American neuroscientist Paul MacLean in 1949. Primarily, there are four functions, and I mentioned these before. So memory, olfaction, emotions, and behavioral responses. So this is a detailed diagram showing the limbic system and its connecting pathways. This complex network includes cortical and subcortical structures, which are important gray matter structures. The cortical structures include the hippocampal formation, which I will be discussing later on, and the limbic lobe, which can be divided into the cingulate gyrus and the parahippocampal gyrus. The subcortical structures shown are the amygdala, the mammillary bodies, the anterior thalamic nuclei, the olfactory areas, and the septal nuclei. I'll be discussing the hippocampal formation and the amygdala in detail shortly, but I would just like to give an overview of the remaining structures. So the cingulate gyrus is a curved, folded cortex on the medial aspect of the brain, directly above the corpus callosum. It is a gray matter structure that is a key component of the limbic system, as it has connections with the amygdala, the thalamus, the cortical regions, and the nucleus accumbens. The mammillary bodies refer to a paired spherical nuclei located on the posterior-inferior aspect of the hypothalamus. It plays a crucial role in the relay of information regarding memory within the Papez circuit, which we will discuss later. And the anterior thalamic nuclei refers to a group of three major nuclei within the rostral end of the thalamus. And this also plays an important role in the Papez circuit and is important in memory. The septal nuclei are a group of subcortical neurons located on the medial wall of the cerebral hemisphere below the corpus callosum, and these have an important role in reward pathways, as we will see later. These nuclei are connected to one another by connecting pathways. These include the alveus, the fimbria, the fornix, the mammillothalamic tract, and the stria terminalis. The major pathways are the fornix and the mammillothalamic tract. The fornix is a large bundle of projection fibers which connect the hippocampus to the mammillary body and is the sole efferent system of the hippocampus. There is one fornix in each cerebral hemisphere, but they are so closely fused that they usually are described as one single structure. The mammillothalamic tract is a prominent bundle of fibers which carry impulses from the mammillary body to the anterior thalamic nuclei. Now we will discuss the hippocampal formation and its role in the Papez circuit. So the hippocampal formation consists of the hippocampus, or the hippocampus proper, the dentate gyrus, and the parahippocampal gyrus. The name hippocampus means seahorse and is derived from the shape of the structure seen on coronal section. This is an area of the cerebral cortex which has rolled into the floor of the inferior horn of the lateral ventricle during fetal life and forms a longitudinal elevation in the floor of the ventricle. Anteriorly, it extends from the amygdala, and posteriorly, it gradually narrows and ends below the sternum of the corpus callosum. So, on the ventral surface of the hippocampus, it's covered by an ependyma, under which there is a thin layer of white fibers called the alveus, which converge medially to form the fimbria. The fimbria becomes continuous with the crus of the fornix. Yeah. So the fimbria thickens as it moves posteriorly and splits off the hippocampus, connecting with the crus of the opposite side, forming the hippocampal commissure. The fornix, which is a single fiber bundle, continues anteriorly to form the anterior commissure. The dentate gyrus is a band of gray matter located between the fimbria and the hippocampal gyrus, and it accompanies the fimbria almost to the splenium of the corpus callosum and becomes continuous with the indusium griseum. This structure is a thin layer of gray matter that covers the superior surface of the corpus callosum and contains two delicate longitudinal bands of fibers within it, which are the medial and lateral longitudinal striae. Anteriorly, the dentate gyrus runs medially across the inferior surface of the uncus. The primary bud spy of the hippocampal formation includes the posterior cerebral artery and the anterior choroidal artery, as seen here. This structure is important in the formation of new memories and is the most epileptogenic part of the cerebral hemisphere. So this is very important in the Papez circuit or hippocampal circuit or memory circuit as it's called. And this was initially described as a neural circuit for the cortical control of emotions. Since then, it has been studied extensively and is now believed to be essential for the consolidation of memory and very important in learning. The type of memory it refers to is episodic memory, and these have emotional associations. It begins and ends with the hippocampal formation as a circular pathway, which provides continual reintegration of information. So the information obtained passes from the hippocampus via the fornix to the mammillary bodies, then via the mammillothalamic tract to the anterior thalamic nuclei. From there, the information is passed to the cingulate gyrus, from which the signals are then sent back to the hippocampus and to the cortex. Damage to this circuit can cause impairment in memory, as can be seen with Alzheimer's disease, Parkinson's disease, and Wernicke-Korsakoff syndrome. Now we'll look at the amygdala, which is another structure which has a key role in the other functions of the limbic system, which we listed before. The amygdala refers to an almond-shaped mass of gray matter, which plays an important role in emotions, behaviors, and our emotional responses to smell. So superiorly, it is related to the anterior part of the lentiform nucleus. Inferiorly, it is related to the anteriormost part of the hippocampal gyrus and the roof of the inferior horn of the lateral ventricle. Posteriorly, it becomes continuous with the tail of the caudate nucleus and the stria terminalis. It receives its primary blood supply from the anterior choroidal artery and branches of the middle cerebral artery. When discussing the amygdala functions, we consider two nuclei, the corticomedial nuclear group, which aids in olfaction, and the basolateral nuclear group, which aids in emotions and behaviors. The main afferents to the amygdala are from the primary olfactory regions and cortical areas, and the efferents include the stria terminalis, which is the main efferent tract to the septal area and the hypothalamus, and the ventral amygdalofugal root, where fibers terminate in the septal area and the hypothalamus and the mediodorsal nucleus of the thalamus. So the second function of the limbic system we'll discuss is its role in olfaction. Specifically, we mean our memory and emotions related to certain scents. So a smell stimulus would trigger the olfactory epithelial cells to the nerves, to the bulb, and then to the olfactory tracts. From this, the olfaction information will pass via the lateral olfactory striae to both the parahippocampal gyrus and the amygdala. The parahippocampal gyrus will store a memory of smells, and the amygdala is responsible for emotions related to those smells. The second function includes emotion or emotional responses. The amygdala receives inputs from the cortex, the temporal lobe, and the insula. These inputs may be an experience, a smell, a taste, or a visceral sensation. The amygdala will receive these inputs in order to process to form emotional responses. The inputs are sent to the septal area and the hypothalamus. Both of these signals are carried via the striatum terminalis and the amygdalopugal pathway. The pathways to the septal area are important to determine whether a stimulus is rewarding or aversive. This is important for learned behavioral processes. So if danger is detected, the pathway to the hypothalamus can trigger a fight or flight response via the ANS and also stimulates the hypothalamus to initiate the hypothalamic pituitary axis, resulting in the release of adrenaline and cortisol. The next function of the limbic system we will discuss is behavioral responses, and this refers to feeding, sexual, and motivational behaviors. So considering an emotional state, the amygdala sends information to the thalamus. There are two nuclei within the hypothalamus, the ventromedial nucleus, which results in satiety, and the lateral hypothalamic area, which results in hunger. Emotional states can also stimulate the amygdala to trigger the hypothalamic nuclei to either stimulate or inhibit these functions. Emotional states can also result in either increased or decreased sexual drive via two pathways. So the paraventricular nucleus can cause oxytocin release, which increases sexual drive, and the medial preoptic nucleus releases gonadotropin releasing hormone, which then causes the release of testosterone, and that in turn increases sexual drive. Some situations can bring about a sense of reward or euphoria, for example, drug use or overeating. When signals are sent to the septal area and the hypothalamus from the amygdala, they both communicate with the ventral tegmental area in the brainstem. This area has dopaminergic neurons, which go to the nucleus accumbens via either the mesolimbic pathway and to the prefrontal cortex via the mesocortical pathway. When dopamine is released, this gives a sense of reward or a feeling of pleasure. So now we'll discuss the clinical significance of the anatomy and functions. So we have Kluver-Bucy syndrome, which refers to damage to bilateral temporal lobes or the amygdala itself. And some causes include meningoencephalitis, particularly HSV, stroke, trauma, and Alzheimer's disease. This results in reduced emotional reactivity, what we call placidity, hyperorality or hyperphagia or even bulimia. The patients can also be hypersexual and can also have amnesia. Amnesia, sorry. Then you have Wernicke's encephalopathy. This is a neurological emergency caused by thiamine deficiency with damage to the mammillary bodies, being a hallmark feature. Without thiamine, there is an inability to convert pyruvate to acetyl-CoA, and this results in a buildup of lactate, which causes gliosis and hemorrhage within the mammillary body, and this leads to amnesia. And this leads to patients filling in the gaps in their memory, which is termed confabulation. So some causes include alcohol, malnutrition, severe vomiting, mercury poisoning, and in chronic untreated cases, it can lead to Wernicke-Korsakoff syndrome, which includes amnesia and confabulation. One of the important clinical applications of the anatomy described include the endoscopic third ventriculostomy. During this procedure, as depicted here, the fornices are in close proximity to the ventricles. Damage to bilateral fornices may result in the inability to consolidate short-term memory to long-term memory. At this time, I just want to show a video of an endoscopic third. Here we can see us entering the foramen of Monroe and above prior. Sorry, play back. Above, you can see the fornix noted. Okay, so I'll be showing the video at the end. Okay. So it also plays a major role in epilepsy surgery. So knowledge of the anatomy and functions discovered over the years have played a significant role here. In 1953, Dr. Scoville, an American neurosurgeon, performed bilateral medial temporal lobectomies on a patient named HM. He was a 27-year-old male with epileptic seizures refractory to anticonvulsant therapy, and it affected his daily life and work. So after he had this procedure, it resulted in severe anterograde amnesia. Within this paper, Scoville discussed, however, that another patient who had unilateral intervention had no lasting memory impairment. He only had temporary memory impairment in the initial postoperative period. And this helped us to learn that unilateral surgery might be best. Since then, this knowledge of the intricate functions of the limbic system played a major role in the neurosurgical management of temporal lobe epilepsy refractory to medications. So in 2019, the first case of a unilateral temporal lobectomy plus hippocampectomy for refractory temporal lobe epilepsy was performed within the English-speaking Caribbean by our very own Mr. Amarin. It must be noted that the preoperative and post-operative neuropsychology testing must be done prior to surgical intervention to determine dominance for speech and memory. So operative options in epilepsy surgery include anteromedial temporal lobectomy, which involves the removal of the anterior portion of the temporal lobe, the hippocampus, the amygdala, and the parahippocampal gyrus. It is indicated in patients with focal epilepsy or hippocampal sclerosis. And another option is the selective amygdalo-hippocampectomy. This is a minimally invasive procedure and is a more conservative alternative aimed at reducing memory decline or cognitive decline. So psychiatric neurosurgery refers to surgical techniques targeting behavioral disorders. This involves the implantation of deep brain stimulation electrodes into areas involving specific conditions, such as OCD, treatment-resistant depression, Tourette's, schizophrenia, anxiety disorders, and addiction. So the use of DBS for OCD is the only procedure that is currently FDA approved. The others are still being investigated. So that is the end of my presentation. I will now show the video. And we'll see it. So this is a video showing endoscopic third ventriculostomy. We'll be entering the foramen of Monroe, and at the top, you can appreciate the phonics. Okay, that is at risk of damage. That is